911, what's your emergency?
Hey guys, you know what time it is? Another rotation remedies right here. Let's do it. So today we're talking about emergency medicine and how to do well on your emergency medicine rotation. So the best part about this type of rotation was that it was a fourth year rotation and therefore there was no shelf exam. So it's all based on evals and it's all based on your performance. Obviously, I'm not going into emergency medicine, I'm going into internal medicine, but some of my best friends are going into emergency medicine and I hit them up for this video in order to find out what you need to do if you want to be an emergency medicine doctor to get the best evals you possibly can. Something to be mindful of when you're doing your emergency medicine rotation is that you're probably going to be working with multiple different teams or different people every time you're in the hospital. So make sure that you introduce yourself to everyone every time you come in. Always remember to follow up on your patient. It may be exciting to pick up new patients as they come in, but you want to make sure that you're watching out for any labs or any imaging to come back for patients that you've already taken care of. And bonus points if you're able to actually interpret the results rather than just say, oh, the results are in. EMRA, E-M-R-A, has these pocket-sized little notebooks that you can carry with you and they're usually very helpful. They look like this. One in particular has some of the most common diagnoses and red flags that you never want to miss. And it also has good differentials that'll be helpful when you're first starting out. Some attendings prefer that you present your differentials in order of must not miss to least dangerous rather than most likely, which can be different from other rotations which prefer for you to list your differentials in what's most likely to what's least likely. For example, in internal medicine, you're gonna say, oh, well, this may be like heartburn or acid reflux, before you're going to say it's a heart attack. But in emergency medicine, it would be the other way around, where you say, well, this may be a heart attack and we don't want to miss a heart attack because that can kill someone. And we don't want to say it's GERD or acid reflux because if we miss a heart attack, the patient can die. Emergency rooms are extremely busy, but you can be really helpful if you gather material, help the nurses to draw labs on patients, and start IVs. In traumas, it can be very exciting, but also very chaotic, especially if you don't know where you fit into the algorithm of what's supposed to be going on. So make sure that you ask your team what they would like you to do before a trauma comes in so you know where your place is once a trauma actually is happening. Most of the time, medical students are asked to help to take the patient's clothes off. Once a patient comes in with a trauma, we're usually trying to expose their entire body in order to look for any sort of signs of injury that they may be unaware of, but that we need to be aware of. So taking off all the patient's clothes, cutting through their clothes if you have to, helps us get to treat the patients faster. Another job you may be given is running to bring the blood work to the lab, especially if it's something like a blood gas, which we need to know right away. Or you could be in charge of putting the patient on a monitor so that we can see what their vital signs are, their temperature, their heart rate, their blood pressure. Early on, you might get in their way if you don't know where to go, so they might ask you to just stand aside, but that's also helpful because it'll give you a chance to see what the workflow is when a trauma comes in so you can be prepared to help in the next one. Patients are sometimes in the emergency room for a very long time, like hours and hours and even overnight. So it's helpful if you can keep them updated as often as possible because you're going to be the person who has the time to do that. Other doctors probably won't have as much time because they'll be busy writing notes or taking on new patients. So if you can go back to your patient and keep them updated on what's happening, they'll really appreciate it, and the doctors will also appreciate it because you'll be keeping a patient from getting mad at them. If you do things like bring them a blanket or bring them ice/water, depending on their NPO status, don't be giving a patient water or ice if you don't know that they're allowed to eat. But doing small things like that can make the patient's stay in the hospital a little bit nicer and can keep the patients a little bit calmer too. Discharge for patients that don't need to be admitted to the hospital is key, and you can help expedite that, whether it's by taking a patient to the CT or getting them crackers and a sandwich for a PO test, basically to make sure that they can eat and pass gas and go to the bathroom normally, or to reassess pain levels to see did the pain get better over time or after we gave some medication. That stuff really gets noticed and it goes a long way. Another recommendation that my emergency medicine friends give is to listen to emergency medicine podcasts. For example, there's the Emergency Medicine Clerkship podcast, and it has bite-sized, like 5-minute reviews of common patient presentations. And the last two things that you may want to do some research on before you start your emergency medicine rotation are
America's next top model is
Make sure that you practice being able to interpret EKGs because you'll be asked to do that pretty often in the emergency room. And you want to know your ABCD, airway, breathing, circulation, and disability. These are the things that you want to check for when a patient comes in with a trauma to see how high a level of acuity you're dealing with. Oh, and another thing that can help you get good evaluations is knowing the basics of a FAST exam. Most of the time when a trauma comes in, we're going to be doing a FAST exam on patients to make sure that they're not bleeding internally or that there is not some other sort of fluid in the body that's not supposed to be there. And residents, usually first years, are the ones in charge of doing this exam, and you can stand over their shoulder and watch and try to interpret what's there. Is there fluid? Is there not? Where in the body are we even located? Things like that. Maybe you'd even get the chance to try and do one. I was in some situations where the attending would say, okay, next trauma that comes in, you're doing the FAST exam. And I was like, what? But I never actually had the chance to do a FAST exam. So maybe one day you'll be more lucky than me. You'll be luckier than me. Okay guys, so those are all my tips for emergency medicine rotation to get really great evals. Remember, there's no shelf exam in this rotation. So good luck. I hope if you want to do EM that you make great connects and that these tips help you to get some really good evals. And I'll see you in the next video. Bye!